when Health Minister Zandile Nsibande announced the first case of COVID-19 in South Africa, the immediate concern from researchers, medical practitioners, as well as civil society organizations was how this can deeply affect those who are already living in difficult socio-economic circumstances. This concern comes mainly from the current state of health in South Africa. I mean, we've seen how it has been difficult for people to adhere to basic preventive measures prescribed by the World Health Organization. Prescriptions such as washing your hands with water, practicing social distancing. These things have been so hard, but we know that they do have a long-term effect on our health system. So today we're joined by Pontsho Pilane. She is an award-winning health journalist. She's a media trainer as well as a media lecturer. We're also joined by Zandile Nsibande. She's from Abahlali Basemjondolo. She's also the former chairperson of Abahlali Basemjondolo Women's League. So Pontsho and Zandile, I have a general question for the both of you. Just tell us, how is it like to access healthcare in South Africa? Zandile, you can go first.
For me, I think this time it's difficult because I will say this this lockdown for us as Abahlali Basemjondolo became a top-down approach, because firstly, I think the president and Minister Zandile Nsibande, they were supposed to negotiate with the civil society. How are they going to conduct this lockdown? At least they should give us 5 days to prepare for this lockdown. And you must remember, it was announced on the 24th. Some of the people were going to get paid on the 25th. Some of the people were going to get paid on the 3rd or 30th or 31st. So some of the people are homeless at the moment. Those people who are renting are homeless because the landlord wants their rent. Even our mothers who are street vendors, who were selling their fruits and vegetables, they were not given enough time to prepare for this lockdown. It became a disaster. Instead of what I hate with this, I like this. I really appreciated what the president said, but what I don't like is that he didn't give us enough time to prepare for it. Because if at least he gave us 5 days to prepare for it, we should have paid our rent, buy enough food for us, and get ready for this 21 days. So the street vendors, now their food got rotten. They stay at home. They don't have money to buy bread for their children. Even the taxi drivers are starving. And then what is the worst thing here at eThekwini municipality? Abahlali are being evicted, whereas Minister Sisulu told all the municipalities that they must stop evicting the people. But eThekwini municipality was still evicting the people illegally. The people who had been occupied land for about a year ago and 6 months ago. So according to COVID-19 precautions, they said you must wash your hands, you must stay indoors. So if you're evicted, where are you gonna stay indoors? Because you are homeless. Then after that, we went to Durban High Court, applying for an interdict to stop the eThekwini municipality to evict Abahlali, but we failed. Then when we say they must give an alternative accommodation, because you know that according to Section 26 of the Constitution, if you're evicting the person, you must give an alternative accommodation. So that alternative accommodation they wanted to give to Abahlali was an insult. They wanted to take Abahlali and let them stay with the people who were smoking drugs on the streets. You know, that's people who smoking drugs where they are kept in the parks and so on. Then we said, no, we can't take Abahlali to that place because within Abahlali, we always say what we put forward is land, housing, and dignity. We want Abahlali to have dignity. Why they will have dignity if they're putting them with the people who are smoking nyawope. And those people who are there, they left their homes and decided to live to stay on the streets and smoke nyawope. While Abahlali are a well-organized organization. So it was an insult to us.
Pontsho, you have been reporting on health for so long. Tell us how is it like to access healthcare in South Africa?
I mean, thank you so much, Tebadi, for that question, because I think it's quite relevant to the discussion, particularly when we look at COVID-19, right? Like in the few years that I've been reporting on health, one of the biggest issues is around access to healthcare in public hospitals and public clinics, right? 80% of South Africans use the public health sector, and that increases because about 16% of South Africans have medical aids, but those medical aids even run out very quickly. So people end up, before the end of the year, they end up going to public hospitals if there's a big health emergency. And that's been a very big issue around the quality of health services and who or where health services are considered to be, like, we have an unequal system. So you can go to one hospital where you are really treated really great, and then go to one where it's dilapidated, where the services are substandard. And so that is the biggest issue. And what COVID-19 has done is that it has, pandemics or health crises like the global COVID-19 outbreak do is that they shine a light on already existing inequalities, right? Like what Zandile has been talking about, which is Abahlali baseMjondolo who have been fighting for the dignity and the rights and the human rights of Abahlali for years. So it's not like this issue started when the lockdown began or when we got our first case. What we see happening is that the health crisis that we're facing exacerbates the level of inequality or the level of oppression or even lack of support from the state or the government to marginalized groups such as Abahlali, to even homeless people, if you think about it, or even what Zandile was talking about around like drug users or people who use drugs. And so we just see the inequalities that existed just become even more blatant and more severe, right? So we're talking about the fact that people who are domestic workers, people who are casual workers, or people who may not have what we call a formal work situation are now stuck. They don't have an income. Like I was, funny enough, earlier today, I was just even thinking about my former hairdresser, like the guy who cuts my hair. I haven't been able to go to him in 2 weeks. That means no one has been able to go to him in 2 weeks. What is he eating? Like I sat in the morning and that was a random thought that I had to be like, what is my barber eating? How is he making money during this time? How are salon owners making money? How are, like beyond just like what we think is quote unquote marginalized groups of people, but how this has higher ramifications for people's standard of living. And the state of our health system has been kind of indicative of this already.
Yeah. Coming back to that as well, the general argument that we hear everywhere is that COVID-19 doesn't discriminate. But in actual reality, access to healthcare does. I mean, there are so many factors that come into play when one has to access healthcare. Issues such as one's financial circumstances or a geographical location. How is it that unequal access to healthcare affect, like we mentioned, the marginalized groups, particularly during this pandemic? Pontsho.
So, Tebadi, you know, what you're asking is a very like clear and complicated question. How does it affect them? Is like it's very clear. Oh, like people are unable to access healthcare in the way that they would normally, right? So, for instance, yes, we know that the lockdown rules under the Disaster Management Act has made health services such as like access to family planning, abortion services, and necessary medical services or health services available, right? There were measures put in place for chronic patients to be able to collect their medication before the lockdown and to collect 3 months worth of medication. There were a lot of hospitals that also were practicing social distancing and all those measures that are needed to protect people. But at the same time, we're talking about, like, for instance, think about people who live in rural areas where tertiary hospitals are very far from them. How do they get there in this time when there's regulations around public transport? How do, if somebody gets into an emergency, let's say labor, how do they access healthcare during this time? So I think for me, you know, particularly if we also look at the kind of conversation that South Africa's been in around universal healthcare and healthcare for all, is that what this has shown is that healthcare for all is not easy. But also, I think for me, you know, as many South Africans also just observing, is the fact that government works. You know, Puta di Chaba in Qaqwa has not had water for years. There are areas in South Africa where access to water has been non-existent for years. All of a sudden, there are JoJo tanks. There are means to ensure that water services are there because of COVID-19. So the question is it a lack of political will or not caring enough until there's a crisis like this? Because COVID-19 doesn't discriminate. So in many cases where like our leaders or people with the means to go to private healthcare can be insulated from healthcare services that are subpar in government. With COVID-19, you're not guaranteed that. We even see the fact that it was middle class, privileged people who brought COVID-19 into the country. And this is not like a blame game or anything, but even that in itself reveals kind of the non-discriminatory way that COVID-19 is. However, my ability to isolate and be comfortable and have 8 Zoom meetings and have this conversation and my life to be swift, or take this time to learn yoga, take up a skill, or whatever other things that I'm afforded because of my middle class privilege, is not something that abahlali basemjondolo or even other marginalized groups, people living in Soweto, people living in rural areas, are able to do. And that's where it becomes discriminatory. But it's not the disease that is discriminatory, it's the system in which the disease or the outbreak finds itself in.
Absolutely. It also brings me back to Zandile's argument that she raised earlier about the brutality that Abahlali has been facing for so many years. Mam Zandile, on the 1st of April, Abahlali released a statement that detailed how your members were not only left homeless, but they were actually, their medication, their clinic cards were destroyed. This has been going on for so many years. How does it make it difficult for not only Abahlali members, but shared dwellers around the country to access basic services?
Firstly, I'd like to thank Minister Lindiwe Sissoul, who was working directly with the Office Abahlali to give us the those Jojo tanks, because in our human settlement, there was no water at all. You find that there were those 10 pipes. You will find out that about 100 people were using, 100 people using one stand pipe. And even the toilet, you find out maybe 1,000 people are sharing one toilet, and even those toilets are not clean. Whereas there are people who are employed by the municipality to clean those toilets. Those people are not cleaning toilets. They're closing those toilets at 4. Then if you want to release yourself after 4 o'clock, you must see where you can release yourself. When they even digging the holes, like those artificial toilets for holes that we used to do in the rural areas. That's what they are doing. But in this issue of COVID-19, what I really hate is that they said they are ready for it. If they were ready for it, why the nurses in St. Augustine Hospital were infected? So when the nurses in Durban, St. Augustine's Hospital, were infected, definitely we as community will be infected, because these nurses are taking the public transport with us, and they're staying with us in the community. But when Zolim Kizes and Ramaphosa told us that they are ready for COVID-19, they were talking why they lied to the South African. And the issue of closing of schools about matric. Our minister Zigalala told us that the schools won't be closed for June and September. They are still negotiating about that. On that note, I think they must also organize some precautions for our children. Maybe they must arrange masks and in order to protect our children from school, because if they are going to school without masks, they are going to infect each other. Even they didn't involve the CPOs, NGOs, and FPOs to have this lockdown. But now you can see the Department of Health, they asking the unemployed nurses to apply in order to do door to door, creating awareness in the community, and even testing the people if they got COVID-19. So even there's a lot of loopholes in this lockdown. Even the sex workers, I think the issue of gender-based violence. I'm very worried that for 6 days after this lockdown, about more than 87,000 people had been reported these cases. Although we know that the others decided to be silent, they didn't report. It's more than we know that if you're staying with your partner, you can't stay with your partner for the whole day, for 21 days without going out and so on. Especially those people who are smoking and those people who are drinking. Because life is about choices. Life is about choices. You can't force someone to stop drinking. You can't force someone to stop smoking. But you must tell them that smoking is dangerous and drinking is dangerous. But you can't stop them. Just close the ship-ins and close the shops for cigarettes. No, that is not good. Because these people are, if the people are smoking, if they need cigarette, then you are his wife. He will be he will be fighting with you because he don't have cigarettes. That's why there's a lot of gender-based violence cases.
I'm glad, Zandile, that you mentioned some of the most challenging things that South Africa has been fighting for so long. I mean, some of the challenges that we had to fight in relation to illnesses is TB and HIV and AIDS. And Pontsho, there has been some sort of debate around whether people with chronic illnesses are more in danger to contract COVID-19 or not. And I feel as though we cannot just move away and not engage in this debate as to understanding, does chronic illnesses such as lung disease actually put people more at risk? South Africa has more than 300,000 people with TB and more than 7 million people are living with HIV. Where does this put us, Pontsho?
I mean, experts have said that people who have underlying conditions like diabetes, hypertension, even HIV and other, like there's a variety of illnesses that have been, including TB as well, that have been listed by health officials and health experts as making you at risk. And what this really means is that if you do contract COVID-19, that you may become what health officials call a critical case. So 95% of people who have contracted COVID-19 across the world, this is World Health Organization figures, have had mild conditions and symptoms where the 14-day quarantine was enough. And while treating it with kind of like homeopathic or other kind of like mild medication, but 5% of cases have been critical, and those are the ones that have mainly also resulted in people losing their lives. And it was a concern regarding our kind of like just last month in March, it was World TB Day on the 24th of March, and a lot of TB civil society organizations focused on the fact that COVID-19 is like kind of manifests in the respiratory area, and that's where TB is, and that could be a problem. But there hasn't been much reported on that, or people who have had complications. Rather, we haven't been told by officials that people who have had complications due to these diseases, but it does put us in a precarious position. I mean, the fact that we have the largest HIV population in the world puts us already in a precarious position. The fact that we are one of, if not the most unequal country in the world, again, puts us in a very precarious position. But our government has been lauded across the world for acting swiftly. And even though there are valid critiques, as we've been talking about, I think that we can, like with the kind of mass screening that's currently happening, where there are mobile units going into communities to test more and more, to screen and test more and more people, shows some level of proactiveness from the government. And however, there are faults, particularly when we look at, again, marginalized people and how they've been left out cold, or how they have not been protected in different ways from making sure that they're not affected. We've had organizations like Amandla.mobi demand that cell phone networks give users, low-income users, free internet data, SMSs, and as well as zero-rate news sites, so that just because you're poor, it doesn't mean you shouldn't know what's happening in the country, in the world around this. We've seen also the cry for the social grants, particularly for pregnant women and children, to be increased, or the fact that we don't have a pregnancy grant to be increased. The calls have become louder during this time around the fact that a lot of people are out of work, they're not working. What is the government doing to ensure that people still eat? There is no there's no clear social protection plan. Food parcels, we haven't really heard the distribution of food in areas where we know people are malnourished. We haven't really heard how learners who go to feeding schools that have feeding schemes, where sometimes the only meal they get is the one they get when they're at school. Now that the schools have been closed for longer, what precautions are being made? And so we're just seeing the lack of, I don't know if it's information or implementation at this point, because I think if it was information, we would have accessed the information by now. But we're seeing a lack of a nuanced approach or a equal approach to ensuring that every South African, regardless of their class, race, gender, is protected, as Mam Zandile was saying. Mam Zandile was talking about the issue of the fact that cigarettes and alcohol are not being sold during this time. And public health experts that are into harm reduction are questioning the decision. Is it a moral decision, or is it, there are two kind of schools about it. A lot of doctors who work in ERs of hospitals are saying that trauma units are emptier, there's less violence, there's less stabbings, there's less cases of alcohol-induced violence that ends up in injuries. But public health experts who deal with people who use drugs or people with, for lack of a better word right now, addiction, have questioned the decision to not sell alcohol during this time. And the correlations between gender-based violence and induced by frustrations and all those things are also quite a real thing. So we have all these issues, it's like COVID-19 is not happening in an ideal society, and we're grappling with so many issues, and I think it's very hard to know which issues matter the most. But I think people matter the most, as a journalist, particularly a health journalist. I think people matter the most, and so it is the responsibility of government and private sector to think of ways of protecting people during this time.
Absolutely. But on that note as well, the advantage that people have been talking about is the idea that now TB machines will be used, the machines that were used to scan the genetic material of TB will now be used for COVID-19. In a way, can we say that the fight with TB has put us in a place that we can say that we are prepared for COVID-19, which is also what Mam Zandile has been saying about how prepared are we? How prepared are we?
I think, Tebadi, yes. I was at the beginning of kind of like the cases in South Africa, or even just like reading about the cases that were happening in other parts of the world. The word contact tracing, I hadn't heard it in a very long time. And for me, I associated with TB because contact tracing was one of the biggest ways in which the government was able to curb TB. Yes, we have the highest HIV population in the world, but TB kills more people than HIV in this country. And so our fight against TB has been relatively successful in various ways because of the fact that these techniques of contact tracing have been used. And we are seeing that kind of knowledge being used for this infectious disease as well. And also the success of the National Institute for Communicable Diseases, the NICD, in dealing with communicable diseases and infectious diseases has been, I think, a lot of help for the country.
Mm-hmm. Mam Zandile, coming back to you, you mentioned Minister Lindiwe Sisulu bring you water to not only you, but to other settlements. What she has also proposed was moving people from crowded areas to less crowded areas as a way of trying to fight COVID-19. But do you think that can work, or will that work? And should she consider bringing resources to where people are? What do you think it works?
Yeah, for me, I think that is also inequality. That's what I said. Everything they make it top down. They're thinking for ourselves. They don't ask what we want. They always looking for us. They don't think that if for instance, Minister Sisulu chose Kennedy Road settlement. So when I'm staying in Kennedy Road settlement, my children are schooling around there in the same ward. Even my place of work, I'm working there. So when I'm being removed from Kennedy Road to the other places, how can I afford? Because they were supposed to ask from the people, is it possible for you to move from this ward? Or if they need to do that, to remove them from Kennedy Road because it's dense, they must look for the alternative land which is around in the same ward. Because if they remove the people from Kennedy Road to the other places, to the other wards, it will be difficult for them to budget, because life is about budget. And I would like to go back to this issue of people living with chronic diseases.
Yes.
For me, I think the good way of doing this, they were supposed to, because in our clinics where we used to take our medication, they got our telephone numbers, addresses, and so on. Maybe they were supposed to deliver our food parcels in our houses.
Yes.
Because they know they even got our houses number, our house numbers. But on that note, they just gave food to the ward councillors. When they're giving the food to the ward councillors, and then the ward councillor had been employed some community caregivers. Community caregivers will write their relationships to have access to those food parcels, and those people who are living with chronic diseases will default, because you can't take medication on an empty stomach. So that's why I said that somewhere around this lockdown was when you're taking 2 slices of bread and you buttered in one side, it was buttered in one side, while it will be cool if the bread was buttered both sided. It was good for them who decided to do this. They didn't think about other people. How will they feel? Even to the clinic. I went to the clinic after I think I went on the 23rd. Yeah, on the 23rd. When I went to the clinic, I went to take my medication. There were no gloves. We're not given gloves. They were not. They didn't care about social distancing. I was asking myself, what are these people saying? Because those people who they are the ones who were supposed to practice the social distancing. They were the ones who were supposed to see that we are using precautions in order not to infect each other. So,
from this discussion, we have clearly laid out how unequal South Africa is. Pontsho, what are the lessons that we have to take from COVID-19 that we should implement moving forward in our health system and in our societies?
Well, I think, what Ma'am Zandile was talking about when she was like the top down versus bottom up, and I think that is, for me, is that the key message is that we need to listen to people in the situations that they're in, and we need to, by we, I mean, but the government, has the responsibility to bring services and quality services to people, meet their needs, or meet them where they are, meet their needs where they are. So, and think about really what the implications of COVID-19 to post-COVID-19 life. What does it mean yes, you know, a lot of health, like I just got this example, a lot of health services are open. But do you think the message is clear that you can get an abortion during this time? Do you think that somebody sitting in a township or anywhere, actually, a young person who's pregnant sitting anywhere has it in them, the confidence or the knowledge that they can go seek out family planning at any time to prevent pregnancy during this time, you know? So it's like, for me, it's too early to talk about what the implications of COVID-19 are. The ramifications we're going to feel for a very long time, particularly when we look at the social determinants of health and what determines equality. And so it's for us to have civil society organizations like Abahlali Basemjondolo and all other kind of people who are marginalized groups who are fighting for the rights of marginalized people do more work, and they become more listened to than government takes decisions that are often I don't think the government ever wants to make a decision that is ill-informed or that is harmful to its citizens, but intention and what is actually reality are two different things. And so if we listen more and if we actually understand the nuances of people's realities in the context of the inequality that exists in South Africa's general society, and if we're looking at health in particular, then we would be in a better position.
Mam Zandile, what kind of change are you hoping to see in your society post-COVID-19?
I think next time, if the government is thinking of making another lockdown, he must consult the civil society. He mustn't just think that civil society needs 1, 2, 3. He must consult them and find out what they think is the best way, like what they do on the amendment of Section 25. Remember, on the amendment of Section 25, they said we must come up with our amendments. Even on this lockdown, they were supposed to say, because we know that the people are dying, but even maybe to give us 5 days ultimatum to say, can you please civil society response? We as the members of parliament, we decided 1, 2, 3. What are you saying? Then we need to come with our ideas, because this top-down approach is so oppressive to the people who have been impoverished during apartheid, who are even being impoverished even now.
Thank you so much, Mam Zandile and Pontsho. We have learned so much from this discussion. I hope that everybody at home listens and understands your points, and I hope the government also listens to the people, as they have more solutions than anyone can ever think. Thank you so much.
Wow, once.
Yes.
Okay. For the last time, comrades, I would like to thank those South Africans who stay indoors. We must understand that Corona is killing. It's not even a silent killer. It's killing. I don't know how can I say. It's like a gun, like the way it's killing the people. The people must listen. They must stay indoors. They mustn't go out like wherever they go. They want to go without knowing where are they going to. And the other thing, I wish Comrade Zandile Nsibande a speed recovery, because we need him. We need him in this struggle of the impoverished people.